Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us again. Amid the COVID-19 pandemic, one thing may not be top of mind for most Americans, and that thing is eye care. However, for the 70 million people worldwide living with glaucoma, they risk going blind if they can't get to a doctor's office for routine procedures and visits. Well, joining us here today is Dr. Tosin Smith, a glaucoma specialist with Glaucoma Associates of Texas, with more on this important subject. Welcome to Health Professional Radio, Dr. Smith.
Thanks for having me.
Dr. Smith, what is glaucoma and what is its impact on vision overall?
Glaucoma is a disease condition that is potentially blinding and can lead to loss of vision over time if not addressed. In itself, it is caused by high eye pressure, and the eye pressure is as a result of buildup of fluid inside the eye. The high eye pressure is the major treatable risk factor for glaucoma. So what we do is we lower pressure to help to prevent the possible complications of glaucoma.
How serious is elevated IOP in glaucoma, and how can that be addressed?
High IOP in glaucoma is a major risk factor for progression of glaucoma. So the way we address this is we lower pressure, and we can lower it several different ways using medications, using lasers, and also surgeries, including minimally invasive glaucoma procedures. Medications are the commonest ways that most people have their glaucoma treated.
I can remember a family member of mine having to give themselves eye drops and later having someone else give them eye drops. What's your experience with patients struggling with eye drop medications?
Many people struggle to administer their eye drops properly and consistently, even though we know that the use of medications to control glaucoma is effective. So that creates a problem because when there is not a consistency in intraocular pressure lowering, you could have progression of disease and ultimately loss of vision because of glaucoma.
Could you tell us about FDA-approved treatment options to address elevated IOP in glaucoma?
So there are multiple treatments available to treat glaucoma that are FDA approved. But what I would say is what we have now is something that's new or different. It's a way of getting medication into the front of the eye that creates an opportunity for this medication to be slowly released in the eye where it's needed. Allergan thought about this and came up with a product called Durysta. It is an FDA approved implant that's placed in the front of the eye that slowly dissolves over time, that releases a drug that keeps pressure down over time, and in studies up to 15 weeks. That product, Durysta, Durysta, is placed in the eye by the physician and releases that medication, taking that burden away from the patient.
Where can our listeners go if they'd like to get some more information?
To get more information about Durysta, you can actually talk to your eye care provider to find out more about the drug, or just go online to durysta.com and you'll be able to get more information about this new medication that's available as an option for lowering eye pressure.
I appreciate you joining us here on Health Professional Radio this morning, Dr. Smith. Thank you so much.
Thank you very much.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.